Hello, I'm Jennifer Moisey, and I'm the Global Medical Franchise Lead of Bacterial Pipeline Vaccines at Pfizer. Clostridioides difficile, or C. difficile, is a bacterium or germ that can cause a serious and potentially life-threatening infection associated with symptoms from diarrhea to severe intestinal inflammation. C. difficile infection is a disease that can have a long-term impact on patients and healthcare providers. Despite recent progress in intervention, C. difficile infection afflicts hundreds of thousands of people across the U.S. and Europe and remains a widespread and potentially fatal disease that can be debilitating. Pfizer, along with a group of experts representing a cross-section of healthcare professionals and patient organizations impacted by this public health threat, launched a C. difficile awareness initiative to raise awareness of the potential risks for and impact of the infection. They also seek to encourage collaboration across organizations to address and help combat this serious and sometimes deadly disease. Last week, we talked about C. difficile in the time of COVID-19. Today, I'm joined by C. difficile Awareness Initiative members Millicent, Gorham, and Christian John Lillis to discuss caring for the C. difficile patient up close and personal. Both Millicent and Christian understand the challenges that C. difficile patients face. I'll let them introduce themselves, and then we'll talk about caring for C. difficile patients.
I'm Millicent Gorham, the Executive Director of the National Black Nurses Association, which represents more than 308,000 nurses, 114 chapters in 34 states, and serves as the voice for diverse populations, ensuring equal access to professional development, promoting educational opportunities, and improving health. Infectious disease nurses are on the front lines of treating illnesses that can have an incredible impact on entire populations, particularly the elderly. The demand for their skills and expertise increases steadily as new infections arise. The National Black Nurses Association is concerned about the increasing numbers of baby boomers with hospitalizations and admissions into nursing homes and long-term care facilities. Nurses have to be ever vigilant to protect the seniors. As the older population continues to grow, our healthcare system will need more nurse infectious preventionists. MBNA is identifying the infectious disease nurses among our membership. It is our intention to publish a newsletter focusing on infectious diseases, including C. difficile, so that more nurses can better understand the impact on the seniors, how to protect themselves, the appropriate safety protocols, and the communication among healthcare providers.
Hi, I'm Christian John Lillis, Executive Director of the Peggy Foundation. My brother Liam and I founded PLS in response to the death of our mother, a 56-year-old kindergarten teacher from a C. diff infection in April 2010. Our organization combats C. diff infections by educating the public, empowering advocates, and shaping policy. Our ultimate vision is for a world where C. diff is rare, treatable, and survivable. A huge challenge in combating C. diff is the low public awareness of the disease and its risk factors. We regularly hear from people who only learned about C. diff when they were diagnosed. A big part of our work is raising awareness so that people can mitigate their risks. Our goal is to reach the 70% of Americans who have not heard of C. diff before they or a loved one become ill. Your listeners can join that effort at C.difficile.org. And each spring we convene a summit where C. diff survivors and family members can learn from and build relationships with policymakers, industry representatives, healthcare workers, academics, and public health experts. We also support the only lobby day on Capitol Hill dedicated to C. diff infections, as well as collaborating with a wide range of industry groups, professional associations, and NGOs to advocate for policies and funding to combat C. diff and antimicrobial resistant infections. We also have a website at peggyfoundation.org that contains a wealth of information and resources for C. diff sufferers, family members, and survivors. This site is also home to our C. diff Stories program, which has collected over 100 accounts from all across the world.
Great. Well, thank you both so much for being here. I want to ask a few questions about your experiences working with C. difficile patients. First Millicent, what are some of the challenges nurses have in educating and caring for C. difficile patients?
One of the challenges for nurses during the COVID-19 pandemic has been a shortage of personal protective equipment, better known as PPEs. Caring for C. difficile patients requires precautions as C. difficile spores are highly resilient and easily transmissible. Since many institutions are running low on PPEs, this has been a major challenge for nurses. Nurses know that C. difficile is a highly transmissible disease, and every protocol and precaution needs to be adhered to and taken seriously. Providing the appropriate personal protective equipment is key to keeping the nurse and other healthcare providers and hospital personnel safe while taking care of a patient with C. difficile. MBNA worked with a well-known musician, a rapper, and Direct Relief to get PPEs to 5 sites at or near MBNA chapters. The celebrity held a dance-a-thon, raising well over $4 million. The funds were given to Direct Relief. MBNA was contacted by the celebrity's representative to get PPEs directly to the nurses. The PPEs that were given were masks, shields, bonnets, shoe coverings, gloves, gowns, lotion, and hand sanitizer. The PPEs were sent to New Orleans, Las Vegas, Detroit, Washington, D.C., and a rural community in Beaufort, South Carolina. The New Orleans chapter shared their PPEs with 2 other Louisiana chapters of the National Black Nurses Association.
Thanks, Millicent. It's really interesting to hear how nurses care for C. difficile patients. And Christian, from your perspective, what are the most important things patients, families, and caregivers need to know about C. difficile infection?
Well, for us, the key to preventing CDI is to understand and avoid the risk factors that you can. That includes the use of antibiotics, living in nursing homes or having a recent healthcare stay, being immunocompromised, and being over 65 years of age. For those with C. diff infection, common symptoms include watery diarrhea 3 or more times a day, abdominal tenderness or pain, fever, nausea, and loss of appetite. Severe symptoms may include swelling or inflammation of the large intestine and toxic megacolon. Toxic megacolon is a rare yet life-threatening complication of severe disease. In fact, my mother Peggy had toxic megacolon, which played a big role in her dying from a C. diff infection. Education and prevention of C. difficile is critical. Certain measures can help limit the spread of C. diff, including thorough hand washing, the use of spore-killing disinfectants, such as hydrochloride solutions, including bleach, appropriate use of antibiotics, and the isolation of people who are infected. We encourage everyone who has been impacted by C. diff to join our movement. It's vital that patients and families play a role in developing policies to combat this disease.
Thank you, Millicent and Christian, for sharing your experiences on working with C. difficile patients. Please join us next week when I talk to James Appleby of the Gerontological Society of America and Artie Shelton of the Vietnam Veterans of America's Veteran Health Council to discuss some of the most vulnerable populations when it comes to C. difficile. Tune in on any podcast streaming app to hear more.